to study about diseases and disorders are abnormal conditions disrupting bodily function caused by pathogens, genetics, lifestyle, environment, and immune dysfunction, classified into infectious and non-communicable, nutritional, or mental health type, diagnosed via symptoms, test and treated with medication, therapies, or lifestyle changes. Disease and disorder theory introduction. Today we are going to talk about the diseases and disorders, the glitches in body's harmony, from infections to chronic condition, understanding causes, types, and management in keys to staying healthy and solving health puzzle. What are diseases and disorder? Diseases, pathological condition with specific symptoms, often named by cause, tuberculosis, affected parts, heart disease or abnormality, diabetes. Disorder, border terms for disrupted function, anxiety, border, blood clotting disorders. Types of diseases and disorder: infectious diseases caused by pathogen, bacteria, virus, fungi, parasites. Example in Pakistan: tuberculosis, bacteria; dengue fevers, virus via mosquitoes; malaria, parasites via mosquitoes spread via air, water, vectors, contact. Non-communicable diseases, not contagious, often chronic, long-term. Example: diabetes, insulin imbalance, hypertension, high blood pressure, cancer, uncontrolled cell growth. Risk factors: genetics, lifestyle, diet, smoking, inactive, and environment. Nutritional disorder, deficiencies, anemia from iron, lack, excesses or obesity or imbalance. Pakistan context: malnutrition in children, vitamin D deficiency, limited sunlight, and diet. Mental health disorder affect thoughts, emotions, behavior, depression, anxiety. Stigma in Pakistan, rising awareness via NGOs, digital health initiative. Genetic disorders, inherited gene mutation, thalassemia in Pakistan, cystic fibrosis globally, may appear at birth or later. Disease in wildlife, autoimmune disorder. Autoimmune disorder, immune system attacks self, lupus, rheumatoid arthritis. Triggers unclear, stress, genetic infection, and implicated. Causes and risk factors: pathogens, bacteria, TB, viruses, COVID-19, fungi, aspergillosis in lungs disease. Genetic inherited mutation, sickle cell anemia, and predisposition, family history of diabetes. Lifestyle: poor diet, lack of exercise, obesity, and diabetes. Heart disease, smoking, lungs cancer, COPD. Environmental pollutant, air in Lahore and respiratory issue, toxin, pesticide, and neurological risk. Age, immunity, elderly vulnerable to infections, cancer, weakened immune in HIV and AIDS. Diagnosis, treatment, and prevention in Pakistan context. Diagnosis: symptoms, physical exam, lab, blood test, cultures, imaging, X-ray, MRIs. Treatment medicine, antibiotics for infection, insulin for diabetes, surgery, tumor organ repair therapies, CBT for mental health, physiotherapy for musculoskeletal issues, prevention in Pakistan, vaccine, polio, typhoid in outbreak, screening BP checks for hypertension, glucose test for diabetes, hygiene, hand washing safe food and water, lifestyle tweaks, diet, exercise, stress management via yoga and breathing. Common diseases in Pakistan: infectious diarrhea, hepatitis E, TB, NCDs, rising diabetes, urbanization, sedentary life, heart disease, diet, hypertension, mental health gaps, depression, anxiety, underdiagnosed, culture, stigma, limit, help seeking. Diseases and disorders stem from pathogens, gene, lifestyle, and environmental non-types, infectious NCDs, genetic, mental causes, symptoms, and tackle prevention, vaccines, hygiene, lifestyle, plus treatment, medications, therapies, and surgeries, causes, symptoms, and tackle prevention, vaccine, hygiene, lifestyle, treatment, medication, therapy, and surgeries.